One of those NHS workers is the Labour MP, Dr Rosena Allin-Khan. She's just finished a night shift working at St George's Hospital in Tooting in London, and the A&E department. She joins us now. Thank you for talking to us fresh off your night shift. What have you been doing?
Good morning. Well, it's been a busy night, as always, because we are a busy London hospital. We are inundated with patients. But what we are seeing is increasingly more patients coming in who are COVID-19 positive. So we are very optimistic that we are an incredible team and we will do what we have to do to pull together over the coming weeks. But we are seeing patients coming in their 30s and 40s who were previously fit and well without any underlying health conditions. So our message is still to people, please, please, please observe the social distancing measures and stay at home and help us help you.
It's interesting that you say that you're seeing people in their 30s, people in their 40s, previously fit and well. I mean, this perhaps goes against some of the conceptions that people have of COVID-19.
Yes, I mean, it really does. And we were hearing so often that it only really affects people over 70. It only really affects people that have underlying health conditions. And that's why I asked the Prime Minister last week in Prime Minister's Questions Times, I said, why are the social distancing measures merely just suggestions? Because what we were seeing echoed on the NHS frontline was the fact that people were coming in who were young, fit and healthy. Of course, the majority of the patients will be older, those that actually require ventilation, but no single group of people are immune.
The government, of course, says it's doing all it can to keep NHS workers safe. The doctors, the nurses, the people really on the front line of our fight against this virus. Is that what you're seeing? Do NHS workers have the protective equipment that they need?
Well, in the last few days in my hospital, they have started to receive the personal protective equipment. And I know that we are very grateful for that because it does make us feel safe when we go to work if we know that we can protect ourselves, potentially stop ourselves getting sick so that we can serve our patients and not spread it to the ones that we love when we come home. But what we really are concerned about on the front line, and I'm hearing this from my colleagues around the country, is the fact that we have some very senior politicians who are saying that they will return to work after 7 days without knowing how long their symptoms will last. And what we are so concerned about as health professionals, and something I'm deeply concerned about, is that the advice that we are giving is actually not in keeping with what the World Health Organization are saying. They are saying that you can still be able to spread the virus long after your symptoms have resolved, and they are actually saying that it is recommended that you stay self-isolated for 14 days. Some people, they have the disease process that lasts for 12 to 14 days. So for senior politicians such as the Prime Minister and the Health Secretary to suggest that they will return to work after 7 days is a real worry for people working in the health sector like myself, because we need to save lives and we need people to properly observe self-isolation processes.
So do you think in that case then the Prime Minister, who's of course tested positive for COVID-19, needs to self-isolate in Downing Street for 14 days?
Personally, I believe that the government needs to change their advice to be in keeping with what we're seeing around the rest of the world and what is in keeping with what the World Health Organization has said. They have said that long after symptoms resolve, one can still be infectious. Now, if we're doing our very best to save lives, to make sure that no unnecessary life is lost, we have to ensure that we are sticking to guidelines that make us able to save lives and for the virus not to be spread. So I would like Boris Johnson, the Prime Minister, to self-isolate for 14 days. Yes, I would.
OK, well, we'll be putting that to other people, I'm sure, later in the show. Interesting to hear your take on that. Now, the case numbers and the death numbers are sadly still going up. Yes. Are you worried about how the NHS is going to cope in the weeks ahead? As Boris Johnson says, he expects the situation to get worse before it gets better.
Look, one thing I am so proud of being is a part of the NHS family. And about 1 hour ago, I left the most incredible team of people. I know that we have the resilience to cope with this. We are strong and we will do whatever it takes to save every single life. We're going to do everything that we can. We can't predict entirely what is going to happen going forward, but what we can do is say to people, please, please stay at home if you can, unless it's absolutely necessary. Please observe social distancing measures, because we need you to help us save your life. And I think it's obviously going to be a rocky road going forward. I know that we can pull together. This is not about political point scoring. It's about saying, let's pull together, let's work together, let's roll out mass testing so that we know what we're working with. It worked in South Korea. It's done well in Germany. Let's roll out mass testing. Let us really understand what we're working with. And then if people also observe the social distancing measures, we can save lives.
Michael Gove couldn't quite tell me exactly when the testing is expected to be rolled out for all NHS workers, although he did say that the government was ramping it up in the days ahead. How important is that testing for people who are working in the health service, and do you think it's been a bit slow coming?
I'm really disappointed that we are not able to test all NHS and care staff at the moment. These are the people who are at the front line. These are people who need to know whether or not they have the virus or not, so that if they feel better, if they're feeling poorly, they can return to work and keep working. But also, they need to be able to keep their families safe and their community safe. And I want to see mass testing rolled out as soon as possible. But it is absolutely urgent that NHS and care staff are tested and they have access to testing immediately. And I'm not sure it's entirely fair that senior politicians are having access to testing when frontline NHS staff who are going in to work night shifts, day shifts, double shifts at the moment, can't get the tests that they need.
OK. Dr. Rosena Allin-Khan, thank you very much for being on the
Thank you
programme.
very much. Thank you.